everyone, and welcome back to Pima Voices. My name is Savannah, and I'll be your host. Today, I'm sitting down with Greg Taylor, who is the Regional Vice President of Community Affairs for Arizona Complete Health, and also a member of the Pima Community College Governing Board. And today, we're discussing how partnerships between education and healthcare strengthen communities, expand opportunity, and create pathways for students to thrive. How are you today, Greg?
I'm doing very well. How are you?
I'm good. Thank you so much for coming in today. I know this has been a long time coming conversation, so I'm so excited to have you here in like what we call the hot seat in the studio.
It's not that hot, so it's all right. I'm happy to be here.
And so I know there's going to be a lot of people who know who you are, seeing as how you are on the governing board for the college. But go ahead and tell us a little bit about yourself and your two roles that you have. Obviously, you have the Regional Vice President of Community Affairs for Arizona Complete Health, but also Governing Board Chair.
Yeah, absolutely. I'd like to think that the theme that unites all of the things I do, whether it's professionally or personally, is trying to build community. And that's something I want to do for other Tucsonans. I'm also a father of four. It's something I want to do for my four children who my wife and I are raising in this community, to make sure they have a place that they can be healthy and successful and thrive and achieve whatever they want to achieve in their lives. So my role at Arizona Complete Health as the Regional Vice President of Community Affairs focuses on what we can do as a health plan, as a health insurer, to improve community level health outcomes. So Arizona Complete Health focuses on Medicaid, Marketplace, and Medicare populations. So it's all government-sponsored healthcare. So we're a little different than other health insurers in that way. And if you look at the research about what drives an individual's health outcomes and how you can improve those, a lot of that is what's called social determinants of health, or health-related social needs. It's essentially the fabric that makes up a community. So it's things like access to affordable and healthy nutritious food, safe and affordable housing, things like educational attainment, and how they can do, or employment opportunities. All of those things actually have a much more significant impact on their individual health outcomes than even the treatment they would receive in an outpatient clinic or a hospital. That's not to say that's not important. Certainly if you're sick, go to the doctor and get that treatment. But just in terms of the course of your life, that's going to be far more greatly influenced by those community factors. So what I do for Arizona Complete Health, and I do with a wonderful team that works with me, is we figure out how do we partner with community-based organizations, and that could be like a homeless shelter or a Boys and Girls Club or a food bank, something like that. Or how do we work with governmental partners? That could be an elected official or a county health department or a housing authority, to figure out how do we strengthen, broaden, and deepen the impact that they're able to make. And we can do that through educating them about what we can do as a health plan. We can do that through connecting some of our colleagues and bringing their expertise. We also do that through our philanthropic giving. And so we do, last year, Arizona Complete Health did about $7 or $8 million in grants across the state of Arizona.
Oh, wow. Yeah.
And so we're also part of steering where those dollars go. And as you can imagine, all of those things kind of blend together and support each other in terms of the effort. So our work is, if we can work with all of these partners and help enhance their work to make communities healthier, we're going to make our health plan members healthier, because they're parts of those communities as well. And similarly, I see that helping to build community role in what I do on the governing board. So this is the first time I've ever been in any kind of elected office. I don't know that I'll ever be in any kind of elected office again. But it was an interesting timing. I've served on a lot of nonprofit boards over the years. I'm still serving on the Western States Board for the American Heart Association right now. I've been on the local Heart Association board. I've been on the Tucson Children's Museum board. I've been in Heart Sounds Mother and Infant Care. I've been on the Boys and Girls Clubs boards over the years. And so when there was an opportunity to potentially run for the Pima board, for me, I don't have any aspirations to be a politician. That's not my goal is in life. But I saw it as very much akin to my nonprofit board service, that this is something that could put me in a position where I might be able to make a positive difference in the lives of certainly students who are served by Pima, the faculty and staff and administrators at Pima, but also the community as a whole. Pima sits at a really incredible place to be able to be an economic driver for this region that will help people attain their educational goals, better their socioeconomic future through the degrees and certificates that the college offers. And I wanted to be part of that. And thankfully, the voters in District 4 decided to vote for me and allow me to do that.
Yeah, and they believed in you, and look at you doing
Look at me
well.
now.
And so I know, like, you've mentioned like a lot of things about like your role and what Arizona Complete Health kind of wants for the community and its giving and its impact, right? And like I see a lot of times like Arizona Complete Health gave to this organization and this one, but you guys did a really transformative amount to the college a couple of years ago for the Health Professions Center of Excellence here at Pima. And so that was a transformative amount of $500,000, right?
Yes.
And so what was the driving force to go? I mean, you kind of already said it, right? About like why Arizona Complete Health does what they do in their need of giving to the community. But why Pima Community College specifically did you guys want to go ahead and do that transformative amount?
One of the things that we were concerned about and continue to be concerned about, to be quite frankly, is the scarcity within the healthcare workforce.
Mm-hmm.
So as a health insurer, as a health plan, our plan is really only as strong as the providers that we contract with and the care that they deliver. There's a lot that we can do as a health insurer, but ultimately, if the doctor's offices, the hospitals, the outpatient clinics, all of those facilities that we work with can't get the staff that they need in order to provide high quality services to our health plan members, nothing that we do is going to make much of a difference. And right now we're seeing healthcare workforce shortages across the board. It used to be just in specific areas or specific disciplines, but now it's everything from physicians to primary care doctors to nurses to techs of all kinds to home care workers to long-term care workers. It is across the board that there is far more demand than we have workforce. And I think that was something that Pima College saw when it originally envisioned the new Health Professions Center of Excellence in terms of expanding its offerings and bringing those programs together here on West Campus to be able to offer some more interdisciplinary looks and to increase the number of opportunities for people to study and then enter the healthcare profession. And that's incredible. And so that opportunity aligned very much with our concern about, well, how are we going to get more people into these healthcare roles? This problem was exacerbated by COVID. We saw a lot of healthcare professionals leave bedside roles because they were burnt out or they had compassion fatigue or they decided they didn't want to go through it anymore. It was an incredibly stressful time. We certainly saw healthcare workers pass away during that period. And then we're seeing some of the aging workforce, especially baby boomers and others who are reaching retirement age and then choosing to retire, which is great for them. But we need to make sure there are people ready to move into those roles because one of the things that you or I or everybody cares, and we're all going to get sick.
Mm-hmm.
Hopefully we don't get really sick, any of us, but we'll all get sick at some point and we're going to need help from someone.
Mm-hmm.
And so we need to make sure. So that this was an investment in two things. One was we wanted to see some additional work around care coordination in behavioral health. And so some of the dollars went to help build some programming within the Health Professions Center of Excellence around how do individuals who are going to work in the behavioral health system with working with people with mental health or substance use issues, help better coordinate that care, not just their behavioral health care, but coordinate across their physical health care as well. There were some dollars within that gift that allowed the Center of Excellence to look at long-term care workforce and to offer some more offerings in that to get people the certificates or the degree programs they need to be able to work in long-term care facilities or do in-home long-term care, which is what a lot of people have in terms of keeping them in their homes rather than like a nursing facility or something like that. And then the last part was, and the most significant part of it was need-based scholarships for students, because we wanted to make sure if there was someone who was interested in joining the healthcare workforce that their tuition or their expenses were not going to be a barrier for them to get the training they needed to be able to be a nurse or a physician or a tech or whatever their aspirations might be.
Yeah, and I mean, you've mentioned, there's a need for healthcare workers across the board. You mentioned some of the reasons why there's that need, generations retiring, COVID, etc., and how important it is to educate the next generation of healthcare workers. And so, how important is it to have that education here at Pima and be able to provide that substantial amount of money to further these students' education, right? And so, how important do you think that is to have the Center of Excellence in Health Professions here at Pima Community College in Tucson to help bring that generation of healthcare workers to their next level?
Yeah. It's interesting. This is actually sort of where even my campaign when I ran for the board blends in, because two of the things I talked about a lot when I was running for the governing board were accessibility and affordability.
Hmm.
And those are really, I think, what define a community college and why Pima within this county is uniquely positioned to be the prime choice for people who are looking to go into healthcare because it's so accessible and
Yeah.
affordable. What is able to be provided here, it certainly including scholarship support, like what Arizona Complete Health provided. But even if you were coming to Pima without any scholarship support, you're going to be able to more affordably get a certificate or a degree that will allow you to get a career within healthcare that will pay you a family living wage more affordably than anywhere else. That includes our university partners, the for-profit institutions, and I'm not knocking them. I think they have a lot of really high quality programs, but the community college, we can just do it at a much more affordable way for people. And as opposed to going to a place that just does healthcare certificates, for example, like exist out there, or maybe an online program, coming to Pima College allows you to not only take the health professions things that you might want for your certificate, but explore any of the other academic interests that you might have. There are tremendous opportunities and programs across all of our campuses, and you can do all of that at the same time.
Hmm.
And you can do it affordably. So it's an opportunity to not only achieve maybe a career goal and an education goal, but other education goals as well. And it's interesting. I talk to folks sometimes, and I am very focused in terms of the work that I do on the economic realities that we face and getting people employed and in workforce. And some people have jibed me in the past that well, education isn't just all about getting a job. And they're right. It's not just all about getting a job. But I think that's why something like a community college, that's important, right? Like being able to support yourself
Yes,
economically is an
yes,
important
very
piece. So we want
important.
people to be able to do that. But because they are afforded all these other opportunities to take advantage of learning about welding or automotive repair or even music or art or anything else that they're interested in, they can get the value of education, which has value in and of itself, and they can get a degree or certificate that allows them to be competitively employed. And we can do that in a more affordable way at the college than I think a lot of other institutions can.
Yeah, I think your role at Arizona Complete Health and then your role in the government board, I think they tie really well together. And, on the marketing side, I see you on LinkedIn, right? I see your posts and you're very passionate. And I love that about you. You speak so well about what you really enjoy about the community healthcare, the community college, how it all ties together. And really, one can't function without the other, right? Like you need education for these people to get a job in the healthcare field. To do that, you need the college, and you need people who are able to support that and fund that. And you guys are a really big part of that. And you have these really great initiatives and community partnerships. And do you think that there are even more opportunities that you see for Pima and Arizona Complete Health to continue working together to support this next generation of healthcare workers in the industry?
Yeah, we are having discussions now about what does that next step look like. I mean, I know one of the goals that the foundation has that I've had conversations with you all about as a governing board member, and that certainly the board as a whole has had conversations about, is what can we do to bring in more operational funding for the college to be able to help. So one of the things that people may not realize, or may not think about a whole lot, is when you hire someone to teach nursing, for example, you have to pay a competitive salary for them that would make it desirable for them to be in that position as opposed to being a nurse. And
Yes.
nurses can make a lot of
Yes.
money depending on which position that they're in. And so oftentimes there's in a much higher cost for some of these workforce oriented programs to bring in the highest quality faculty and staff that we can, and staff instructors or faculty members. And so how do we help offset some of that cost through private investment. So we've been having some conversations about whether that's Arizona Complete Health or whether that's others. And this is true not just in healthcare, but in a lot of workforce programs about what can we do on the private philanthropy side that will help bring in sustainable dollars in the form of maybe endowment funds or something like that will continue to provide resources to be able to support some of these programs that will lower the college's cost, which will allow us to better control potential future increases in perhaps tuition or property tax or whatever we need to do as we go into the future. So we've had a lot of discussions about that. The other piece that I think from Arizona Complete Health that we've already supported, but I hope to continue to support, is because the community college is so accessible and affordable, the cross-section of students that we have here is really a cross-section of Tucson.
Yes.
And they have so many diverse needs. And so we've contributed, for example, we contributed last year, and I hope we'll be able to do it again this year, dollars to support the food bank here that we're doing to support students. Because unlike a traditional university student, most of our students are part-time, they're working, they're parenting, they're, doing all of these things. Maybe they're also Arizona Complete Health plan members. Maybe they're on Medicaid for their health insurance and they have us as their health plan. And so this is another avenue to be able to reach those same individuals that maybe the college is serving and Arizona Complete Health is serving, to help them to meet those needs about access to healthy food and nutrition or other avenues. So we've been talking about how we work together to help meet the social needs of students that can certainly be a barrier to achieving their health outcomes, but can also be a barrier to achieving their educational outcomes. And maybe we can do those both at the same time.
Yeah, I think you guys are saying a really great example as a company and even yourself as an individual of like what can happen when you speak and act on wanting to create that change. And it's not just about, oh, let's provide scholarship money, right? Or let's like help this building get put together and new equipment. It's understanding there are other barriers within someone's educational journey, like food or even getting to work, whether it's taking the bus or something, right? And so understanding those other data points help bring together bringing that college experience a little bit better and easier for that non-traditional student, essentially, and understanding like it's not just about that scholarship funding, but rather how can we help them succeed in all areas of that. And I think like I said, you as an individual, Arizona Complete Health as a company, really showing all the other initiatives that you support are showing that it can succeed far beyond the classroom and far beyond just that initial support, right? It goes further. And then you're seeing the success rates of graduation and students actually completing their courses or transferring and getting the jobs. And so it's all just part of a working wheel, right? And so you guys are doing a really great example of showing of how all that comes together to work really well and how that really ties in to keep Tucson thriving and succeeding, really.
Yeah, thank you. And I believe strongly, and I think it's reflected in what Arizona Complete Health does as well, but these are investments in people. And when you invest in people, they take those investments and they will propel themselves forward in whatever way is going to be appropriate for them and their skills and their ambitions and their goals. But ultimately, if they're going in a positive direction and you invest in them to go in a positive direction, it will help all of us in some way. Maybe they become a nurse at a hospital that treats me someday. Exactly. What if I get, knock on wood, if I get admitted to the hospital, or maybe they become a police officer or an EMT, or they work on the airplane that I'm going to fly on and make sure it doesn't crash to the ground. So you'll never really know, but it's going to happen. And I think you can logically infer that. And I believe strongly, and I think Arizona Complete Health believes strongly, that those investments are worth making in people, in their health, in their futures. And then ultimately, we're all going to be better off as a result.
Yeah, and no, like you make really great and valid points, and like I said, I can hear a lot of the passion of what you do, not just like your role in Arizona Complete Health, but also how that ties into your role on the governing board, you yourself as a father, as an individual, and how that speaks. And I think that really ties in together of all the work that you do across all areas, right? And so thank you so much for all of that, because I think it does help make a difference. Like maybe not immediately, but it raises voices, right? It raises concerns. It brings a discussion to the table. And so that's the start of change and start of impact. So thank you for everything that you do.
Oh, absolutely. I appreciate it. Thank you for saying that.
And before we end our session today, because I feel like we could just keep going. I say this to everyone. I'm like, I wish we had more time, but was there anything that you wanted to add on or share or just anything in general that you wanted to reach out with for the community today?
I would just encourage people to, and this is speaking as a board member, to stay engaged. I know that this is an incredibly scary time for people in a lot of ways. It's an incredibly destabilizing time, and a lot of things that people have felt like they've been able to count on, they're now questioning whether they can count on those things. This is the beginning of my second year as chair on the board, and will be my last year as chair. When I became chair, I said I'm doing 2 years as chair, and that's it. I'm not doing any more. So I'm looking forward to one of my colleagues. I'm not leaving the board. I still have 3 years on my term, but I won't be chair. But what I tried to do in this first year, and I hope people have seen it, is try to provide stability. It's, try to, and we did that in a number of ways. We did that through trying to be transparent as we can about information when we know it, and be transparent about what we don't know. We tried to provide stability through not raising tuition nor taxes last year. And at the same time, the college was hit financially, federally, with changes, but we tried to be transparent about how we were going to weather those things and what the plan was and how we were going to move forward. So I would encourage people. I think there's a natural tendency when people are afraid to disengage, to not be part of something, because they're not sure what's going to happen, and they just sort of circle whatever their wagons are and protect what they have. And I get that that's why that helps people feel more secure. But as a board member, I so appreciate people's input, whether that's during public comment, whether they're shooting me an email and sharing their thoughts. And we have to make decisions that we believe are best for the college. And no matter what decision you make, some people like it and some people hate it.
You can't please everyone.
It's just the way that it is. But I mean, whether we make the decision that people want us to make or not, I so appreciate that engagement, that people are willing to come and have civil discourse with us, share their thoughts and their ideas. Because I will say that, some of the most interesting ideas that I think we've been through over the last 3 years, 1 year that I've been chair, and then the other 2 years I've been on the board, haven't come from me. They've come from people who have approached me and said, hey, what about this? Or hey, what about that? Or hey, we think this is important. Let's move it forward. And so I just want people to stay engaged. It is our board meetings are a place where you can come, you can share your thoughts freely on what's working well, and what isn't working well. I think people usually are more open about what isn't working well, but we do like to hear about what is working well too, because there's a lot.
Too, yeah.
Exactly, there's a lot that is
Don't
working well.
forget about it.
But please share those thoughts with us and be engaged in those processes, whether it's directly with us as a board or whether people avail themselves of the lots of opportunities and in the shared governance-y way that we put things forward in the college. Please stay engaged in these processes. And no matter what's happening federally or internationally, or what people's thoughts are about it, if we can stay focused on what we need to do for Pima County and Pima College, we can continue to make a positive difference here for this community and our students, no matter what's happening at the state level or federal level.
Start here, start small, right?
Yeah.
See what we can do for our community and work together, because it can be really hard to work together in times where people are scared or fearful or just unsure of what's going to happen. So that's a really great point. I appreciate that. And if someone can't make it to a board meeting, they can watch it live on YouTube. It is on PCC TV stream. It's recorded, so if they miss the live stream, they can rewatch it and things like that. So there are ways people can still engage in those meetings and at least listen and hear what's being said, and then maybe they can engage next time. So
absolutely. And you can certainly show up and participate in public comment, but we also still have virtual public comment at every meeting. And so if somebody can't take the time to come down to the district office to join us, but you can be on Zoom for a few minutes to provide your comments at the beginning of the meeting, you just have to do it 24 hours in advance so that we can set it up. You sign up online to do that. So you can provide a virtual public comment. Yeah. You can be there in person, or certainly on the governing board section of the website, you can find all of our email addresses. You can email all of us or your individual board member based on your district, and make sure your thoughts are shared that way too.
Well, I'll definitely link all of those things there so the community can have those firsthand, and if they wanted to explore those options, they definitely can. But thank you for talking with me today and sitting down and sharing passion that you have for our community, for the college, for the work that you do as a whole. And just thank you for your partnership as for Arizona Complete Health. Like, thank you for your partnership with Pima Community College and everything that you believe in with, again, the Tucson community as a whole, right? Like, it's not just the college, it's the community. And you can really see that in the work that you guys do. So thank you for everything.
No, thank you. I appreciate it. It was fun to be here.
Thank you. And thank you for everyone for tuning in today's episode. And I'll see y'all next week. Bye.